In the studio, joining us now, the project manager of the Institute for the Advancement of Minority Health, Miss Demitria. Demitria. Demitria, I said it right. Love, thank you. So glad you joined us today.
No problem. Thank you for having me.
All right, so where your institute, is it located in Mississippi? This is a Mississippi organization?
Yes.
Okay.
So we are located in Jackson, Mississippi. We have 2 offices. One is on Lakeland Drive and one is in the Jackson Medical Mall. So, yes.
Okay, so tell us exactly what you do. What's your mission?
All right. So at the Institute for the Advancement of Minority Health, our vision, our goal is to stop health disparities amongst underserved and underrepresented minority populations in the state of Mississippi. And so we have a special emphasis and focus on health equity. So that's pretty much what we do.
I got you. And so that being your mission, specifically then, what actions are you taking? What are you doing to kind of eliminate these disparities?
Okay, so we do a lot of programs. We're funded by several different organizations, the CDC, the Kellogg Foundation. So we pretty much look at a few of the issues that are going on in minority communities, and we develop projects based on those. So an example of some would be our OD2A program, which is our Operation Data to Action, and that deals with the opioid crisis that's going on in Mississippi. We also have the Kellogg program, so that's dealing with health equity, making sure that minority populations get proper access, proper knowledge, proper care. We also have a maternal and child health program, a tobacco cessation program that's hosted in the Delta. So we pretty much take these initiatives and we run with them and create projects to help those communities.
So it sounds like a lot of just education.
Education and implementation.
Okay.
So with the maternal and child program, child health program, 2 weeks ago we had a community baby shower where we registered 75 women. They were unexpected mothers, and we gave them big boxes with food, pacifiers, information, everything. So we're not just information only. We definitely get our hands dirty.
Demitria, I speak to a lot of physician friends, some of which are OBGYNs. I've got friends that are nurses that work in the NICU at UMC, which is an incredible facility up there. And they speak often about the fact that so many of the problems associated with childbirth and right after childbirth could be eliminated with proper and good prenatal care. Mm-hmm. But a lot of times that just relates to lack of access or sometimes just lack of understanding of the need for that care.
Yes.
So is your organization involved in that in any way?
Yes. So part of the maternal and child health program is that we are having some of these focus groups where we talk to these unexpected mothers and we give them information about the need for prenatal care. We also give them access to care, linkage to care. Okay. So things like that. We don't just tell them, we do our best to link them to what they need.
Okay. So some of these outcomes, I'm told, could be totally avoided with proper prenatal care, but a lot of times the expectant mothers don't know. Or don't have access to prenatal care, especially when they get some of the remote areas and the rural areas of the state. And I know that's an issue, and to a great extent that does affect the minority population, the underserved population.
Yes.
Yeah. So, well, that's good stuff. So, the opioid situation, which it seems like it's kind of taking a backseat. You don't hear as much about it, but it's still going on. I mean, and I don't know that it's gotten any better. I think it's gotten worse with the pandemic in particular. And folks being locked up and going through some, mental challenges and despair, if you will, of just the situation, to some extent contributes to misuse of opioids. Well, I don't think to some extent. I think it does, and I think that's established. So what is your organization doing with respect to that?
Okay, so at the Institute, we've been funded by the CDC. The CDC is partnered with the State Department of Health and the Mississippi Public Health Institute. And so we are a sub-grantee of the OD2A program. And what we're doing is creating task force, which will serve as a resource pool. We're trying to get out the information. One of the greatest things with the population is most of the time a population that is affected does not have the knowledge of what's going on.
Yeah.
They do not know the extent of, the dangers that's going on, especially with like opioid misuse in Rankin County.
Yeah.
And so what we're doing is right now we're hosting webinars. So we're giving an educational piece where we can inform inform the community at large. We want to inform your common people. We want to inform law enforcement officers. We want to inform health professionals just about what's going on. And I think that it's great that you say it during the pandemic, because research has shown that there has been an increase in opioid use over the course of the pandemic.
Sure.
And the increase is not just with prescription. What happens is a lot of people haven't had access to their physician. And so what they do is they turn to street drugs. And so you see an increase in opioid deaths because these street drugs that they're getting instead of their regular prescriptions are often laced with fentanyl and things like that. So it's in turn causing deaths. The pandemic has really hit the opioid crisis really hard. Yeah,
so more than just COVID, it's kind of the secondary effects as well of the pandemic, the restrictions, the lockdowns, loss of work, et cetera, that have contributed to an increase in drug abuse, which is in many cases resulted in death. So it's, it kind of has a trickle-down effect in that respect. What about just mental health in general? How does your organization address that in the minority community?
We don't have a program that's dedicated towards mental health right now.
Okay.
So what we do is with any program that we have, we try to find different sectors and factors that we can attach it to. So that's why I chose mental health. We've had webinars with the opioid program that have been dedicated to the use of Narcan. We try to educate, so we take the common issue and we try to divide it into little sectors.
Yeah.
So there's not a specific mental health program right now, but with every program that we have, we try to find a way to incorporate mental health into it.
I got you. And so when we talk about educate, like even going back to opioid, how do you transact that exactly? Are you going into schools, for example, and conducting events and seminars, if you will, training sessions? How exactly do you do that from a logistical perspective? What does that look like?
Okay, so pretty much day to day, what we do is we kind of share our information. We share fact sheets. We create these fact sheets that kind of give you a snapshot.
Okay.
We are learning from our task force what people want to hear, what they don't want to hear. We know that they want things kind of short and simple. We're in that age now. So we want to share these simple facts across social media platforms.
Yeah.
Because we are in the age of COVID, we're not able to just directly go in. So we host these webinars that will be online on Zoom. And that's just the way that we can handle it now. I'm sure when everything opens up, loosely stated with our quotations, when everything opens back up, we'll be able to go into those schools. I know that we have another sub-grantee that we are partnering with on our task force. They do go into these schools, and I know that the YMCA does go into schools and that they talk to them. But right now, just for our own safety and protection, we're strictly staying virtual.
Yeah. Yes, and you talked about the funding, CDC, and also private institutions such as Kellogg's, I guess, foundations that are providing grants as well. That's the primary source. So how many people are in your organization?
Okay, so right now our staff is of 6. We have our CEO, we have 2 program managers, and we have 2 community health workers. So our organization, we can go ahead into it. It was founded in established in 2019. So we're relatively new.
Okay.
We are relatively new. And for this program in particular, this one is funded by the CDC, but we do have other programs that are funded by the Kellogg Foundation, Robert Wood Johnson Foundation.
Are there similar organizations in other states?
I'm not sure that are doing what we're doing.
Okay.
I'm not sure. I know that there are similar organizations within the state that is doing what we're doing, but I'm not sure if they're anywhere else.
I know you've only been around a couple of years, but have you got some success stories that you could share, or any sort of data about the positive results that are being produced?
Yes. So our greatest success story is that all of our boxes for the community-wide baby shower were taken.
Yeah.
You would think that in the age of COVID, people would not come out, but it was just a pleasure. So everything that was registered, diapers, sizes 1 to 5, food, everything was given and taken. So every donation that's been given to us, we've kind of been put back out there.
I got you.
We also give out PPP. We give out hand sanitizers, masks. So our success story is that everything that we have to help the public has pretty much been given away, and it's been received.
Okay.
So, yeah.
And so what kind of response have you gotten from the public? Has it been received in a positive way? Yes, for sure. Once again, I just know with the Maternal and Child Health Program, because that's the one that we actually went outside with, they were very receptive, very grateful. They participated in another project of ours, which is the lead assessment. So helping them on one end can kind of get you what you need and open the door to educate them on other issues as well. Yeah. I got you. Well, awesome. Well, we're about out of time right here, but Demitria, really appreciate you coming in today. Sounds like you guys are doing great work. Appreciate
Yes, sir.
it.
Thank you. Thank you for having me.
You bet. Thank you. Demitria Love, Project Manager, Institute for the Advancement of Minority Health. We'll take a break right here. We'll be back on.